Okay, hello everyone. Welcome, welcome. Good morning from the west coast of the United States, but good afternoon or good evening wherever you're tuning in from. Welcome to the second Setbacks in Medicine discussion. I'm really excited that you all are here today. My name is Madalena Conti. I'm a medical student, usually based in New York, but I'm taking a year off between my third and fourth year, so I'm currently in California. And I'll be facilitating the discussion today. Before I give a brief overview of what this series is, I first just really wanted to thank every single person who has tuned in today. You all have taken time out of your Sunday to listen to and share stories of setbacks in medicine, and I just really appreciate you all for being here. And I did want to give a special thank you to the phenomenal Jack Penner, Anna Fretz, Ramya Sampath, Gurbani Kaur for really sharing their stories during the discussion today. This discussion wouldn't be possible without them. So what is the Setbacks in Medicine series? So as I said, this is the second session, so some of you may know, but for those of you who don't, this series is a space where we can really come together to share stories of mistakes and setbacks in medicine, and importantly, what helped us move through these setbacks. And in terms of the why, or the reasoning behind this series, in the first discussion, many people shared their thoughts about, what is the point or what is the value of sharing stories of mistakes and setbacks in medicine. And some of the ideas that came up that I'll just summarize briefly is that, first, hearing others' stories of setbacks helps us remember that we're not alone when we have our own setbacks or make mistakes. Second, we can learn from others in terms of what helped them move through their setbacks. And then lastly, not sharing mistakes really is doing ourselves a disservice because it ultimately creates a culture that doesn't foster learning or improvement. So for this discussion, I actually wanted to pose a different question to the audience and the whole group before we jump into the stories. And, in my experience, setbacks and mistakes in medicine are really rarely discussed, they're rarely talked about. And I wanted to ask you all, why do you think that is? Why do you think that despite us all experiencing setbacks and making mistakes, these stories are rarely talked about? So I'll give everyone a few moments, feel free to unmute if you want to share your thoughts, or I'll give everyone a few moments to put their ideas in the chat. Hans, I see that you put an idea in the chat. Would you want to unmute and share why you think mistakes and setbacks aren't often talked about?
Yes. Well, here in town we have M&M rounds, but they are strictly, really, and the word is on, strictly seclusive. So nobody allowed to go in, and only the physicians among themselves. And then we try to learn from each other's mistakes. Now, most recently, however, it was very difficult to find mistakes, which of course is definitely not the case. So now we have the amazing rounds where they only talk about their success stories. But I made one comment, and one of them is, and that's my as far as I am right now, experience from the medical, from the residency interviews. You have some setbacks or some area where you're weak, and you have to present it as a strength, which I totally agree with. But in all honesty, this is so difficult a field that I myself, while I was with my mom, guiding her through, yes, while she was really sick, until we finally had the diagnosis, which, by the way, at CP solvers if somebody comes in with hypercalcemia, for instance, dizziness and all the symptoms and has a huge calcium, and you find swollen lymph nodes in the chest and in the abdomen. We would only need 10 minutes to come up with the right diagnosis. It took them 5 weeks, and then they had a differential diagnosis and discharged the patient. So we diagnosed her here in Huntsville and treated her for lymphoma. And it was definitely not the best way to treat a patient. Another setback, again in Germany, was when after her treatment for sarcoidosis, which was a lymphoma, she was allowed to go to a rehab, and the doctor said, you're not allowed to swim, you're not allowed to do this. And so she was not even allowed to participate in those great things they have in Germany, like they have Moor baths and all kinds of things we don't have in the States because we simply don't have them, nobody has time for them. And they are really great. And that was an assistant doctor from another country, I would say ill-educated. So I'm talking bad, but these are all negative experiences that I made.
Yeah.
And that's all happened while I was in the States. So now.
No, Hans, thank you for, I appreciate you sharing that. It's not easy to talk about, difficulties that you've experienced, in a different country.
My mom was afraid of swimming here in Huntsville in the lake, but now every morning she's having a swim and says, well, I'm not afraid anymore, I enjoy. So you see, it takes a lot of patience. We have to listen to our patients. Sometimes it just helps them by them giving an opportunity to talk. And I've seen excellent physicians at the University of Tübingen in hematology and oncology. We get the most difficult cases done, but it takes so long until you end up at such a high specialized center where you get whatever you need, from stem cells to CAR Ts and whatever.
Yeah. Ramya, you've also shared a really wonderful point in the chat. Would you want to unmute and share, why you think it's not, common to talk about stories of setbacks?
Sure, absolutely. I had just mentioned that I think sometimes it can really be a coping mechanism to focus on moving forward rather than to feel the pain that comes sometimes with actually being willing to experience and re-experience and expose some of those difficult memories and difficult thoughts. Jack, I'm glad you liked my use of the word plumb, but yeah, to plumb the depths of some of those more vulnerable parts of ourselves.
Yeah, I completely agree. I think that was beautifully said, so thank you. When I was kind of thinking about this question, I was honestly actually not sure why mistakes aren't talked about, and I was thinking, perhaps we're fearful that sharing mistakes make us look, weak or unqualified to do our jobs. But in my opinion, it really just makes us human. And what I do know is that when I've had setbacks in medical school, what has helped me is not feel alone and learn from the setbacks. And really that's just the goal of today's discussion, to do that. But ultimately we'll see where everyone's stories takes us. So to jump into it, the topic of the discussion today is, I think I let you down. And I'm really happy we have a variety of levels of training, both in the people in the audience, the chat, and in the audience. So in the terms of the people sharing stories, we have two phenomenal medical students. We have, we just heard from Ramya Sampath and Gurbani Kaur, who are both fourth-year medical students, Ramya at the University of Rochester and Gurbani at UCSF. And we also have Anna Fretz, who is about to start, or has already started, her chief resident year at UCSF. And we also have the one and only Jack Penner, who is an attending at UCSF. And before we dive into the stories, I just wanted to say to the whole group that this is really an open discussion between everyone. So please feel free to share any thoughts you have, either out loud or in the chat. We can all learn from each other. So to get started, Jack, I would love to start with you. And what story comes to mind for you when you hear, I think I let you down?
Yeah, absolutely. First off, thank you so much, Madalena, for putting this together. I know that this has been an enormous amount of work to organize both the time, but also find the people to engage with it. And then I want to give a huge shout out to all 33 of you, I guess 32. I'm not gonna shout myself out for being here, but all 32 of you who are here to tune in at this, because I think I couldn't agree more with what Hans and Ramya and what you said, Madalena, that the ability to sort of hold our own humanity, which is what many of these setbacks are, period, is a challenge, but to do it amidst a culture that sometimes expects maybe more than what is humanly possible at times is a really steep hill to climb. And so hopefully we can make that hill a little bit less steep with some of these conversations today. And I think, I'll be honest, when you asked me about this, there was, I wish that there were fewer stories that came to mind, but there were a lot that came to mind to potentially choose from. I think the one that feels the most potent is one from my like the end of my third year of residency, actually. And I'll sort of summarize some of the details and sort of gloss over them just to protect patient privacy, but we'll do my best to keep some of the salient features there. It was essentially a patient who came into the ER and was being admitted to our service for some pretty benign symptoms, but some possibly sinister findings on his initial workup in terms of a really concerning heart rhythm. It was a patient who had a wide complex tachycardia, and it looked, for all intents and purposes, we were sort of grappling with, like, is this VT, or is this a less malignant arrhythmia that can look like VT in the setting of an underlying bundle branch block? And I think the way that it ended up sort of playing out was myself and one of my colleagues sort of came to the conclusion that this was the more benign, that this was most likely the more benign version. So not VT, but SVT with aberrancy, given multiple factors, but acknowledging that it was sort of a hedge, right? Like there was no 100% definitive way to know, but we felt like this was the most likely diagnosis in this case. And so the plan was to bring the gentleman into the hospital and manage him for this sort of relatively benign and treatable condition. Before we were sort of bringing him upstairs, it was late in the evening. I was talking to the patient's son, and he's like, should I stay? Should I go home? It was sort of during the COVID pandemic, and I was saying to him, like, I think go home, get some rest. It's been a long day. Like, you can come back tomorrow. And he was like, okay, but like, I really want to be there with him. Like, this seems worrisome. I was like, I really think like the night is going to be smooth. Like, all signs point to this being a smooth night, and I think that you can go home. Fast forward like 2 hours, it turns out that the patient's heart rhythm devolved into a much more malignant arrhythmia. And he ultimately ended up passing away. And the son was like just getting home when we called and let him know what had happened. And I think this was a challenging situation for a handful of reasons. I think one of them was the fact that it was a really devastating passing of a patient that was quite unexpected and felt like very linked to cognitive decision making that we had made just really minutes before. We were sort of grappling between two possibilities, felt like the less sinister one was more probable, but the more sinister one was still possible. And I think went with one decision, and then and he ended up passing away. And I there's no way to know, but there always is the question of if we had managed it differently up front, what would have happened there? And that was really, really hard to sit with, both in the moment and since then. And then the other piece of it was, right, a similar judgment. I made a similar judgment, telling the son that I thought he could go home, and so not only did this decision impact, or this decision that we initially made, did this play a role in this gentleman's passing, but also did that second decision play a role in his son's ability to spend his last moments with him. And so there was a really rattling night and a really rattling encounter. It was compounded by the fact that I was like so shaken after this, and went and actually made two basically like two medication dosing two medication dosing errors, like about 90 minutes after this happened, just from a place of not really focusing. Luckily, that there wasn't any significant effects to that, but I also did have to disclose my mistake in ordering to another patient after the fact. And I think, so it was, I think this sense of, I think I let someone down happened basically 3 times over the course of a few hours. One, which was with someone who I wasn't going to have the chance to share that with them, that I think I let them down. The other was having to have the conversation that, I misjudged. And, when the son came back, I had to share with him, like, I made a mistake in judgment. I should not have told you to go home. And I'm really sorry that cost you this time with your dad before he passed away. And then the third hit after that. And I think to have to do to have to think about one of those felt like an enormous amount to hold, but let alone 3 like that. It was a tough night. And I think events like that, at least for me, like it intersected with me in a way at that time that was particularly potent. It was like the end of my 3rd year of residency. I was about to start chief year. And it was sort of like a lot of things that I was like, I should be able to do X, Y, and Z. I should be able to, differentiate SVT with the Baron Z from VT. I should be able to, accurately counsel family members on whether or not they need to stay in the hospital. And I should be able to write, basic medication dosing orders safely, or I should at least be double checking that. And I think it collided with my sense of self in that moment in a way that was disruptive. And I think, what can feel like guilt quickly morphed into shame, right? Rather than like, I didn't make the best decisions. It became like, I am somebody who is not making good decisions, or rather than like in that moment, I was a fallible human doctor. It was like, am I actually a good doctor? And I think that while it seems like semantic details, that view of oneself as I did something bad versus I am bad is a really potent difference, and one that I think is really hard to, or can be really challenging to stay away from, because of the silence and the way that these things haven't traditionally been talked about as much, right? It's much easier when we to calibrate ourselves against our peers and to calibrate our experiences against our peers or people we admire. And so to know that this has happened to someone else can make those moments much, much easier to metabolize. I think, in the interest of time, I won't share right now in terms of like sort of how that process unfolded, but I think the sort of grand challenge in that was how to hold compassion for our own, at least for me, for my own humanity in those moments, that like, we made the best decision we could, and nonetheless there was a bad outcome. And it feels really, sometimes it feels okay to say that, of like, I did the best that I could and I didn't pass a test. It's different when it's like when it's like I did the best that I could and it potentially impacted somebody's survival. And I think I will not pretend to know how to hold that perfectly, but I think reaching into this space of really being like, how do we hold that for ourselves and for our friends who may have similar experiences over time. And I think there are potentially ways to do that maybe we'll get into over the course of time. But in that moment, and I think even still when these things come up, it really is a challenge to hold ourselves and to let ourselves be held by those around us, because that requires a huge amount of vulnerability to let ourselves be held in those moments, because we have to share and tell people about it. So I'll pause there and turn it over to others. We'll really look forward to hearing from the group kind of ways that you all have learned about how to metabolize these moments, or to borrow Ramia's words, plumb them, to sort of clean out the pipes, because the pipes can definitely get really clogged after these moments.
Yeah, something I just want to say is, I think you've hit on such a universal challenge that we all experience, in that when something goes wrong, we make a mistake, it's so easy to equate that with your identity. It's like, oh, I am not qualified. I'm not good at this. I'm not good at that. And you really internalize it and equate that with your identity rather than, the difficulty of viewing it as an external event that you're involved with, but it doesn't necessarily have to say anything about your identity. I think that really is a universal challenge that I know I've gone through, and I think so many people have. I would love to hear from you or from anyone else here, what have people found helpful in, making that distinction from, when you make a mistake, not internalizing it as this is part of my identity and I am a bad, unqualified XYZ person, but rather kind of trying to separate that and moving through it. What did you find helpful? And I guess if anyone else has any ideas to share.
We can start as people think. I think the identity piece that you mentioned is so key here, and I would say like this. Oftentimes, like the identity of being somebody who not only loves clinical medicine, but within that world has a particular passion for and enthusiasm for reasoning. That was a challenging identity in that moment. So it was like I spend so much time thinking about making effective decisions amidst uncertainty and amidst challenging probabilistic decisions when and doing that in a way that is hopefully aligned with the priorities of patients and their family members. And I think that identity is one that I've held really, really, really close over the last few years, and potentially I think in that moment it exemplified that I maybe held it too close, because there was the identity hit of these terrible outcomes, but it also intersected in a second way of like there being even more self criticism that came up of like, not only am I about to move on into like out of training soon, but also like this idea of like I'm supposed to be a clinical reasoning person, right? Like that is something that I think was an identity that was really close to my identity as a physician, and also I think my identity as a person in some ways. And so I think to be able to like sort of examine that and be like, if there is a pie, like how much of the pie is occupied by one specific thing. And then also I think there is something to be said for process versus outcome oriented, like viewing things through a process versus an outcome oriented way, because I think probability will change into possibility when it's a single case, and that can be really hard if we view outcome as the way in which we measure the work that we do. Obviously there needs to be some of that, but if that's the only thing that we look to in amidst all of the uncertainty that we have to grapple with and the sort of chaos of clinical medicine, that's a really flimsy it's a really flimsy hook to hang our hat on, or to hang our sense of self on. And so I think being able to sort of look back and be like, okay, well, like let's look at the process and try to sort of not necessarily take the emotion out of it, but really examine the decisions that were made amidst the information that we had, and sort of be like, okay, what can I take from it, and what things are potentially the possible but improbable conclusion. And I think focus, like going back through it, talking to friends about it, and looking at the process rather than the outcome, as well as being able to sort of realize like to sort of find ways to maybe distance or not have that single identity, whether it's as physician or anything else, be such a large part of it, because it is a huge part of who many of us are. And it's whether it's physician or just clinician or practitioner in any way. But when it becomes that whole pie, I think it can get really hard to hang on to ourselves amidst these really challenging things that we all go through so often.
Yeah, I think I just want to thank you for sharing that. I mean, if you can see in the chat, so many people, I think have had experiences similar to that. And, as I've talked about, because medicine often requires so much of us, it's easy for it to become such a huge part of our identity and such a huge part of the pie. And then when something goes wrong, it's so easy for that to take a hit to the identity. But just thank you so much for walking us through that and kind of what helped you move through it. Just thank you so much. Anna, I would love to see if you wanted to share a story, either any reflections from this or your own story about a setback you've had?
Yeah, absolutely. Thank you again, Jack, for sharing that. I think very much like Jack, when I heard the prompt of, I feel like I've let you down, a patient story was what came to mind first. And it was, again, in making a medical error. And to share the brief background behind that medical error, it was similarly, it was when I was an early senior resident and kind of like taking care of patients as like the team leader for the first time. And it was a patient that I had known for a while in the hospital who had very advanced multiple myeloma that was treatment refractory. And I had misdiagnosed her with bacterial pneumonia, and she eventually ended up decompensating. And it turned out she had like disseminated a fungal infection and ultimately passed away. And it was never part of like my kind of diagnostic decision making up until then, when she got really, really sick, that this could be a disseminated fungal infection. And so it was in that diagnostic reasoning error where I felt like I had really let this patient down, and then also reflected a lot kind of with the patient and her family on how I let her family down as well. And when this happened to me, I was obviously very, I was like heartbroken that I had made this error. And I won't belabor like all of the kind of like brilliant things that Jack had just mentioned about how it really challenged my identity as a doctor, someone who was interested in medical education, and also really wanting to like do right by this patient specifically. This was like a patient that, this was at our general hospital. She was a patient that kind of hadn't historically received the best quality of care for a number of different social determinants. And I like really, really wanted to do right by this patient. And so there was kind of like that added piece. So I felt absolutely heartbroken I had made this error. Aside from like the kind of emotional piece, one of like my instincts initially was to like intellectualize the experience. And I actually felt that this was a very helpful thing, both because it gave me the opportunity to like cut myself a little bit of slack on being so hard on myself, but to really like dive into all the different branch points that I had made and thinking about the patient diagnostically and therapeutically. So kind of like intellectualizing that piece was helpful. And then I also felt like in doing this and in kind of going through this exercise, like I really felt like I owed it to this patient, and I felt like I owed it to future patients to understand, okay, what were the things that I could improve upon going forward, or what knowledge gaps did I have, or what cognitive biases did I have that contributed to why I, made the decisions that I did. And so I think the intellectualizing, while it's a very, very helpful component, but I don't think it should be like the only process that happens. And I think there's the humanizing piece that's also really important. So one thing, I went to somebody who I perceived to be in like a position higher than me. And I actually think that like going to someone who you view as a mentor is an important piece. It's always helpful to like go to a peer because they feel very safe. But I think for me, going to somebody who is a mentor, and I've actually talked to Jack a lot about this specific case. Jack has been a tremendous clinical and personal mentor to me over the course of my residency. And going to somebody who's like in a position of power, quote unquote, and discussing it with them, and then hearing from them that, oh yeah, I've made these errors as well, or I can relate to this specific thing. I think knowing that there's community in wanting to do the right thing and having it not always go as we hope, knowing that is a common experience was a very reassuring thing. So that humanizing piece for me as a person and as a clinician was really important. But something that also has been encouraged by different mentors I've had throughout residency is humanizing it from like the patient perspective. in that, you know, learning about how this particular error, letting this patient down, how it's impacted them, how it's impacted their life. And it doesn't always need to be like a diagnostic error that's like resulting in patient death or something, but to really just get a sense of how exactly our behavior has impacted them. The reason I think that this is so important too is, I think the sad thing is that the question, or like the response we might have to, I feel like I've let you down, might become a quieter and quieter voice in our heads over the course of medical training. It's really easy, I think, in the field of medicine to just like, there's so much that comes at us all the time that it's, I think it can be really challenging to remind ourselves to like say those things and be reminded to like be reflective. And so I think humanizing it by like learning more about the patient and exactly like the scope of our impact is another really critical thing. And then I just wanted to highlight something that Charmaine had said in the chat in case not everyone can read it. And that's along the lines of humanizing it from a personal perspective. What kind of would you say to a friend, or what advice would you give to a friend? Because we are, being in medicine, we have kind of achieved the success we have because we're really critical people of ourselves. It allows us to, you know, do a lot and grow a lot. But I think it is really important to remind ourselves that we are our own toughest critic. And so in kind of externalizing it and thinking about what we would say to a friend is another very helpful exercise to do.
Anna, you just gave like, so that was just so wise. And I know that it has meant so much to me and to everyone here that you opened up and shared that experience, and especially just what you shared about what helped you move through it. That really stuck with me and something that I will remember when I'm, you know, inevitably in a difficult situation like that, you know, going to your mentors who are above you, who can share similar experiences. I think the point that Charmaine made, you know, what would you say to a close friend if they were going through something like that, to have some self-compassion? So just thank you so much for sharing that wisdom with everyone. And I want to ask, you know, as you've progressed through residency and have had situations maybe not exactly like that, but something similar, have you approached it differently? Or yeah, how has that kind of affected how you have managed situations that are similar as you've progressed through?
That's such a great question. I think the thing that maybe not so much how I approach it differently, but in terms of how I balance those different parts of kind of like the reflective and growth process, is that I've really tried in becoming more comfortable with myself as like, I'm a clinician and I'm trying to do right by every patient I take care of, and like knowing that that is like my mission, and becoming more comfortable with that and probably more confident throughout my training as well. I've really tried to like dial up the like humanizing side of it, and that like I really want to understand and be reminded by like the impact that I have on a patient in letting someone down. And I think for everyone, this is going to look different because, you know, certainly it's going to like look different on different days. Like say there's a day where I'm just like, something terrible is happening. I'm just like, I might not have the space to like go talk to this patient's family. And like, I have made this error, or I told them that like, you know, you could leave the hospital so you could go home for your child's birthday, and that's not going to happen. And hearing that that I've disappointed them, I might not be able to handle that on one day, but on like the next day, you know, going into prepare myself. And the reason again, I think just going back to this, this piece of, it's easy to become so callous and forget for something that like feels so routine for us. It's really easy to become both callous and kind of more disconnected from your patients as humans. And so I think going back to really hear from them and learn from them is a part that I know, while it might be hard to hear in the moment and challenging, is going to keep me more connected to the mission of why I've gone into medicine, and that's to like help people. It's going to keep me more connected to medicine in the long run. And it reminds me, another like kind of global, I guess, like tip I have for people who are listening. These are like, I think, all things in different way, like shapes and forms that I wrote down when on my like essays to enter medical school. And like so often I will go back and reread my essays on going into medical school, because I'm like, oh, I was such a pure soul, and I still am a pure soul. And the field of medicine has hardened certain parts of me. But I think going back to like really remind ourselves, when we're having moments where like our identity and passion is being challenged, going back to just like reread that it won't hurt, I promise.
That's such amazing advice. I love that. Thank you so much, Anna. Ramya, you said that your story is somewhat related. Would you like to share your experience?
Yeah, absolutely. Thank you so much for having me here. And I will really try to bring out what spoke to me so much from Jack, from the story that you shared, and from Anna, the story you shared. My story hails from about a year and a half ago, on my very first week of my medicine clerkship that I was so excited for. When, at the end of this first week, my mind is spinning. I'm trying to put together this whole gestalt of how do you approach a patient? How do you do it all? And I met a patient who, I will try to obscure some of the details, but I'm sure I'm going to let some through, who was so sweet, had a very rough winter with many asthma exacerbations, many hypoglycemic episodes, COVID, just a lot of things going on, and was so looking forward to a much healthier spring, and was planning to move, and had spent, a lot of time telling me about all of these hopes. And the one thing that they had said was how much in the past hospitalization they hated being intubated, and while they didn't want to have a DNI, signed or anything, that they just really, really, really were hoping to avoid that on this hospitalization. And so I put together all of the information I've gathered, and I give a little presentation to my team, and I talk about the blood sugars and the 500s, and talk about the dyspnea and all of this stuff, and doing my best as a first week of third year medical student on medicine clerkship. And so then we make a plan for the day, and I think it's going fine. And the next morning, it's a Saturday, and I get a text from my resident who tells me that a code has been called for this patient, and that someone had noticed a mental status change in the last hour, and code was called, and I should get there as soon as possible. When I get there, I see that, this patient is sort of having like a waxing, waning level of interactivity, consciousness situation, and a decision is made to intubate this patient. And, in that moment, although I'm remembering that the patient had expressed, I really don't want to be in this position, I really want to get out of here, I want to be healthier, it seems medically necessary, that makes sense. So the patient is then taken to the MICU off of our service, and I continue to follow. I just want to make sure, I want to know what happens to this person. And so I look in the medical record, and I find out that actually just after the patient gets to the ICU, someone checked a blood glucose, and actually the blood glucose was in the 30s. And then someone rapidly corrected that with dextrose, and the patient was responsive and was actually able to come off the intubator a few hours later. But that, I kept following the chart notes and all of that, and found that the family and the patient were really upset about what had happened, that this patient had been intubated when it may not really have been the most indicated at the moment, and that if someone had checked a blood glucose, maybe there could have been something done about that. And this experience, it's sometimes hard to tell, why is it this experience? Why is it not the other experience? Why did this one so shape everything for me? But it really profoundly impacted me, I think, in a lot of ways. I think I felt so much guilt for all of those human ways that this did impact the patient. And I think some of the things that you mentioned about really thinking about, how is this impacting this person? What are all of the hopes and dreams that this patient expressed to me that may not necessarily accord with what happened on the ground? So I felt a lot of guilt about what actually happened. But I specifically felt like I had failed this patient in two ways. And now maybe in retrospect, it seems a little bit, I'm able to have that perspective of, well, what would you say about a friend? What would you say to a friend for whom that happened? But specifically, I felt like, why didn't I think to check a blood glucose? I was in the room, I wasn't doing anything. How could I have not thought to check a blood glucose? It's so basic, it's so simple. And the second thing is that I felt at the time like I failed the patient by not doing a better job with chart review. Because if I had done a better job with chart review at the time, I would have found that several years prior, the patient actually also had a similar hypoglycemic episode with a very modest increase in basal insulin dose, and that maybe I shouldn't have suggested something. And so I really felt this weight of like, maybe because in my presentation, I said that we should increase the basal insulin dose, that all of this stuff happened and all of these things. And, in retrospect, it feels so easy when I look upon another third year in the same position to say, of course, this is not on your shoulders alone. It's not, you're never doing something alone as a third year medical student, you're operating in a whole team. But I also felt like I had failed myself in some way. I felt like I always told myself, with my active social science and humanities background that believes so much in the value of narrative investigation, that I wouldn't be that person who forgets to do all the things. But I think it's always easier in retrospect, as people are mentioning in the chat, it's always easier to know what went wrong because you're able to analyze it. And I think in retrospect, I am better able to analyze all of the factors that contributed both to why what happened, and also why did I receive it so poorly? Why did it impact me so much? I think I'm able to see that in medicine, we function as teams, and that's a great thing. That just as we function in teams, the responsibility was not mine alone. There are so many layers of supervision, and that's why those layers exist. And in fact, I ended up talking to my clerkship director about this experience during like a mid-clerkship meeting. And she mentioned to me, I recognize the patient because your attending actually had a really hard time with this as well, and talked to me about it when we were on service together, and felt really terrible that this had happened, and was really just carrying the weight of this by himself. And I think that was really kind of a balm to me to hear that not only am I struggling with this, but actually my attending is also struggling with this, and that this is something that maybe we could possibly talk about. We were both at the end of our service at the time, but I think it also sort of reaffirmed to me that the learning never ends. The fact that my attending really felt the same way about this, despite being so much further along in his career, reminded me of all of the times that we will feel like we've failed our patients, and all of the times that we will hopefully learn from those incidents to do better. I think it also it reminded me that all of those kind of self-critical questions that we've mentioned, I think if they lead us to sort of dig ourselves into a hole that we can't get out of, that is truly counterproductive. And if what they instead encourage us to do is to seek humility and to be humble about the fact that we're not alone, and that we shouldn't be alone doing all of these things, and that we shouldn't really stop seeking how we can prevent these kinds of errors, but that we should also accept that at some point they will happen, and the goal is to just keep sort of cyclically reviewing and figuring out where can we mitigate those sources. And I think I also took away from this that we're always going to be pressed for time. And I think that sometimes, especially as an earlier trainee, it can feel like when we're told to be efficient, that sometimes that makes it feel like we're supposed to skip over things for the sake of highlighting the more important things. But I think it actually especially clarified to me that being efficient is actually more about preventing missing things and being able to quickly cover a broad swath of information and being able to pick out the important things rather than to skip over things. So I think this one experience actually really just taught me a lot about my own desire to be good at medicine and to not miss things and to not let that patient have a springtime that wasn't as healthy as they wished for, but that really the goal is to just keep circling back and to keep investigating how we can do better and to rely on the resources that we have.
Ramya, I think that, as we're all kind of meeting each other for sometimes the first time in these sessions, and I think that story just says a lot about you. That one, I think it's so powerful that as someone early on, that you told a story about an experience early on in your training, that I think even though we are all on teams and there's this collective group to carry these weights, I think everyone has this experience that even early on, you feel that weight of potential mistakes or things that you forgot. So I think you sharing your experience has just been very impactful for me, and I'm sure a lot of people at early stages in their training. So thank you for saying that. And then what I was saying about in terms of how much that says about you, I think the attitude that you just alluded to about kind of that constant growth and using experiences like this to, one, not forget why you went into this, kind of to have that compassion with the patient, but then also to have that constant reflection of how can I continue to grow and continue to be better for yourself and for your patients. That's just such an important reminder for all of us, and I think just says so much about you. So I really can't thank you enough for just taking that difficult experience and turning it into such a beautiful opportunity of growth for both you and for all of us. So thank you so much, Ramya. I would now love to transition to Gurbani. Gurbani, would you like to share an experience that you've had or a setback you've had?
Yeah, I think mine is somewhat related and can build off of themes that we've heard everyone else share so far. So I'll go ahead and start. My setback that I was thinking, I also, very similar to Jack, have had many setbacks and too many to pick from, but I will share from my medicine core clerkship experience. So it was the beginning of my core clerkship, and I was really, really excited to be there. Also knew that I was like not going to know a lot, just like at the beginning, and it was like the beginning of my third year. But I remember being it was like my first or second round of admitting patients, and was particularly excited because like one of the things that our team was doing at the time was they would go around and ask all the people on the team, like, what is like your ideal like bucket of things that you want to admit today, just to like get us excited for call. And I was like, we haven't seen anything palm related, so I wanted to see something palm related. And they're like, well, yeah, good luck, this is like the COVID pandemic and you're probably not going to like see anything much except for COVID if that were to happen. But nonetheless, towards the end of my call shift, I hadn't had an admission yet, and we finally got one, and it was going to be in the palm category. It wasn't going to be a very difficult one per se, but my team thought it just for fun, they would like hide certain parts of information from me and send me down to sort of figure things out. And so I ended up like, this is not where the issue comes in, but like we end up going down, learning about like hemoptysis, weight loss, kind of like piece it all together, and find out a little bit later that like the hidden parts of the story that become more relevant are that this patient is sort of a middle-aged man who had previously been diagnosed with cancer and was coming in and having, you know, similar constitutional symptoms, and his like team had basically gone through extensive lengths to track him down. He had moved to get him to come back after routine labs at a visit were concerning, to get him to come in a coordinated way. So that basically we were just doing an admission to like get him there the next day. He'd be NP overnight, and then next day he was supposed to get the CT scan and kind of like follow up and go from there in terms of next steps. So I came in the next day, all excited and hyped to like give my like admissions presentation, and I went to go check in on him, and I felt like he was sitting there with a breakfast tray, and I like do my normal like, oh, physical exam stuff, whatever. I know he hasn't eaten at that point, and I see him eyeing food, and it just completely went over my head that we had ordered NPO at that point. And I did my typical medical student thing they tell you to do, which is like ask your patient, like, is there anything I can do to make your day more like comfortable, like make you have a better day or anything at all? And he asked me for sugar for his coffee. And I was like, yeah, of course, gladly. So I run out the room, and this is like while we're pre-rounding, and I'm like, oh, I have like only so much time left, like gotta go find a sugar packet, and then I also need to like go get ready for morning report. And it didn't hit me until I literally gave him the sugar packet and like basically okayed him to consume this meal, and then walked out the door, where I was like reviewing my notes, and I was like, oh no, I just told this person they can go against like the whole plan that we came up with. And I'm a third-year medical student. I'm just starting. I have just derailed like the whole point of him coming here for this. Like, it's Friday, he's gonna get the scan, and then the whole plan was like he was just gonna go home from there and then follow up afterwards. And I was really scared. I was really scared to bring it up, but at the same time, I knew I had to do it. So I just basically, I went in to the team room. I found my intern, and I was just like, I think I did something wrong, and I think that this patient cannot get this scan. And we ended up like, I felt like the whole team like paused, like everyone just stopped doing what they were doing. They're like, wait, what are you talking about? And I explained like the situation where I was like, I went to go get the sugar packet, and then like blah, 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 and like was like pretty like frantic about it. And just felt like the way that everyone responded, I felt was like a pretty positive thing, but like internally, I continued to like just like freak out in my head. Like the intern immediately starts like looking up like, why on earth was my order like not like followed or whatever? And it like we ended up like all basically sitting down and realizing that this was like, it wasn't necessarily an error. Like, yes, I like played a role in part of the error, and that the food tray was already in front of him, and like the coffee was already there, and I like basically said yes, but that he was gonna eat this meal anyway because it was placed in front of him. And apparently this has not been the first time that this has happened. And what happened was that when he was admitted, the intern had put in the order, but it was just like order of operations, and that first puts in an NPO order and then like put in another order so that like the patient could have dinner that night. And so that was like read as like an override or whatever. And so that's like kind of like what had happened. And I think in sort of like seeing the whole team sort of just like stop everything that they were doing. Luckily, like there was like nothing like super acute or anything going on. And then having the intern and the senior and our attending all like at different points, like basically like the intern and I went to go to like disclose the error together, but the intern never put it on me. And like really, I felt like was like really shielded from having to accept any blame in the situation. And just like, I don't know, just like the way that we all kind of went through that morning together and then continued for the rest of the week to explain like we can work with this patient and have him stay the weekend, even though he's going to hate it, and get this all rescheduled, and like had like our attending called like the radiology attendings and like set things up so that like if he wanted to stay like on Monday, he would like have a spot to do his test. And like hearing like the chief like reflect on, or sorry, a senior resident like reflect on like how like this has actually happened before, and like maybe like something should be implemented in terms of like the EHR, whether that's going to happen or not, I'm not really sure. And just like how we kind of all came together in that moment, I felt was like pretty empowering, but simultaneously also I felt like I've reflected on this like experience and other mistakes that I've had kind of in third year. And I just felt like consistently, like as like the younger you are in medical training, I feel like there's like a lot more shielding that happens in terms of like yeah, you're there to learn and you don't necessarily have like the most responsibility, and like the weight doesn't like necessarily fall on your shoulders. But then like as you continue to get more responsibility and a little bit more of that like weight is there, it's a shift. I feel like it can be very jarring to like be in a position where you're like, well, now for the first like for this time, this mistake, it feels like I can't go back. Like I don't have my shields. Like I don't have like the intern to come swoop in and apologize on my behalf. And I think for me, it's just been something that I've been kind of grappling with as I've started my fourth year and have been, like you don't go in and do admissions with your intern anymore. You are expected to, go and take an independent history and kind of start like running plans and stuff in a more autonomous but still like supported way. And it just, I think that's just something that right now is something that I'm kind of navigating in terms of like setbacks and developing autonomy, developing an identity as like a soon to be physician, but like not quite there yet.
Yeah, Gravani, I think, something that really struck me about your story is that, as you touched on and some other people touched on, we are on teams for a reason. We have this collective weight to kind of, we're in this together when we're carrying the weight of these mistakes that happen. But what struck me about what you said is kind of what we can do as individuals to respond to these mistakes. And I think you just gave a beautiful example of when you play a role in a mistake that happened, you just acknowledged it. You went up to the team, you were very clear about, this is what happened. I accidentally gave the sugar packet, they were NPO, they're supposed to have a scan, and you were just honest about it and did not shy away from it or hide the mistake or what your role was. And that to me is very inspiring. Even though it was, as you said, just a sugar packet, it I think just says a lot about this larger reminder that I need to keep in mind. I think a lot of us can too, about just not hiding from any mistakes that we make, but for the benefit of the patient, being honest about it with your team and with yourself, because that will ultimately lead to better patient care and will help, you kind of move through it. So I think that was just really striking to me. So thank you for sharing that reflection and that story. I think a lot of people can take something away from that. Did you want to share anything else about how anything you learned from you've already shared what you've learned from it, but any other reflections on that?
No, I don't. I think no, it's just like been my I think the other thing that's been helpful is being able to not just like reflect on it with like the team that is also taking care of this patient or is a part of it, but it's been like part of our curriculum is that we have these different touch points and sort of like reflecting on past experiences is just part of our curriculum. And so like being able to have that space with like people I trust in my class, and I'm hearing like an outside but like peer perspective, as well as like these sessions are usually led by like attendings that like gives you a little bit of a different insight as to what could be going on and how to navigate it in a different way. I think has definitely been helpful, and I think this has just been like a collective struggle of like understanding, like I think that especially as we move, I think for us in our curriculum it's pass fail for core clerkships, and then when you move on to sub internships it's like graded for the first time. And I think that's like one thing that a lot of people in my class are kind of like struggling with, this like transition from like now for the first time like feedback that like isn't necessarily just like glowingly positive. Like it makes you think a little bit differently about like, oh, does that mean that like they don't think that I can be an X type of doctor or a Y type of doctor, or like can I recover from this feedback, like, or is it over, like is this all over for me? And I think that's just like something that I don't really have an answer for. You just kind of have to go with the flow of like, that's part of like mistakes are part of learning. And I think that it's hard when you don't really have to be accountable in some ways for them until you do.
Yeah. Thank you, Gravani. So it's about 6 past the hour, and I want to be respectful of everyone's time here, but I just want to give a huge thank you to Jack, Anna, Ramya, Gravani for sharing these experiences that you've had. I know I have I'm taking away so many pearls, and I think I'm still thinking about a lot of what you all have said. But it takes a lot of courage to reflect on these setbacks and to share them out loud. So just really can't thank you all enough. So if anyone has any last things to say, feel free to jump in and say anything. If not, we can end the session. Okay, awesome. Well, I'll see you guys all next time. Take care, everyone.